Advocates for inmates incarcerated by Arizona's Department of Corrections, Rehabilitation, and Reentry say ADCRR doesn't have what's necessary to run a successful healthcare system, according to the ACLU's motion for a receiver. Lawyers say NaphCare, the for-profit healthcare provider contracted by the state, remains woefully inadequate.
My whole neck, I've lost 4 inches in my height.
Mary Whatley is incarcerated at the Perryville women's prison. She's having issues with what's called the thecal sac, a protective sheath around the spinal cord, and she needs surgery.
I have to have this surgery or I'm going to be paralyzed, is what the nurse practitioner who are providers here told me.
She has a history of vertebrae fractures and neck trauma that causes numbness, tingling, and pain in both the neck and arms. Whatley doesn't know when her next appointment will be.
And it's not just me. There's other women here that need surgeries and care that they're not getting.
ADCRR has more than 100 healthcare positions vacant, the ACLU says, via its latest motion in the ongoing Jensen v. Thornell lawsuit.
It's a battle in here.
Erin Taylor is another inmate at the Perryville complex. She has brain cancer.
It's very hard to get appointments.
In 2022, she had surgery to get some of the tumor removed. She says there was a long wait to receive radiation treatment.
For about 15 months, I asked for some aftercare. Radiation didn't begin until July 2023.
Taylor says there's been miscommunication between the prison's medical staff and her oncologist regarding how long her chemotherapy should last. In the motion for a receiver to take over healthcare throughout the state's prisons, ADCRR is accused of frequently using telehealth when it's clinically inappropriate and dangerous. Due to a judge's order to fix constitutional violations found at trial, court-appointed experts reviewed countless death reports that documented horrible care, leading to unnecessary suffering and lost opportunities for treatment and cure, and ultimately death, per the ACLU. Here's Lauren Beal, attorney for the ACLU of Arizona.
The ways that those things are happening come through a few structural issues that we identified in our motion. One of these is extreme delays in people getting the care they need. Another one is a real difficulty getting people to specialty appointments.
As for the staffing shortage, Beal says there aren't enough physicians providing care, instead nurses who don't have the same training. Court expert reports say, quote, NaphCare offered a paltry $2 per hour increase to physician salaries between December 2023 and July 2024, and has made none since, end quote. We reached out to NaphCare for comment. A spokesperson says the provider is proud of our record of successfully recruiting and retaining healthcare staff to work in Arizona's prisons, and there are more healthcare professionals working in ADCRR prisons than ever before. Also saying each of the 9 state prisons has a full-time medical director with 13 additional physicians across the state, and 2 more have been hired. The spokesperson tells me pay rates compete with market rates. Meanwhile, ADCRR's responses to court monitors' reports cite challenges with changes through third-party vendors, which means NaphCare.
Passing the buck and saying, this is NaphCare's responsibility is simply not an excuse, and it's not going to work for all of the people and all of the families of the people who are incarcerated.
We've also asked ADCRR about Erin Taylor and Mary Whatley's alleged treatment delays. The department is prohibited from discussing inmates' private and protected healthcare information with third parties, but a spokesperson sent us a statement that reads in part, quote, "It is important your viewers are made aware of the systemic shift in healthcare and prison operations having taken place during the last 2 years, the likes of which include modernized and gender-specific care and services for incarcerated women. To perpetuate a narrative of what happened under a different administration as current practice is dangerous and false.